Hello again. Now, the coronavirus pandemic not only puts numerous industries out of business, but it's also managed to reverse work done and progress made in fighting other diseases and epidemics worldwide. Malaria is one such. Due to concerns and fear over infections, many patients stopped scheduled visits to clinics, leading to an increase in cases and number of deaths. According to a World Malaria report by the World Health Organization, an estimated 241 million malaria cases and 627,000 malaria deaths were reported worldwide in 2020. Now, this while the world is also dealing with the effects of the coronavirus pandemic. Goodbye Malaria founder Sherwin Charles joins us now to discuss this further. Sherwin, good afternoon. Thank you very much for your time. We've seen a number of other campaigns of other diseases, including non-communicable diseases and also life-threatening ones like TB being really badly affected by the focus on the pandemic. Correctly so, because you also had to fight the pandemic. As far as the fight against malaria is concerned, have you seen the gains you've made in the last decade being significantly reversed in the last 2 years?
I thank you very much, Dan. I don't think we've seen a significant reverse, but we've certainly seen stagnation. Last year, the World Malaria Report, for the first time since the year 2000, showed an increase in the number of deaths from malaria to just under 500,000 people passing away. And so COVID certainly has had a big impact. We've seen people not seeking access to healthcare. We've seen the numbers in terms of visits to clinics that are down. But the biggest impact in terms of malaria has been the global impact on supply chain, and that affecting us locally, where our access to commodities have been hampered by the disruption to supply chains around the world.
Okay,
and that has been the cause for the increase in the number of cases and the number of deaths.
What kind of commodities would these be that you're referring to? Could you just expand on that?
So we've seen the greatest impact to the commodities that we use for vector control. So having access to the insecticides that we use for our indoor residual spray programs, having access to insecticide-treated bed nets. These are not being delivered on time, as well as then access to diagnostics, the test kits, and the medication that is needed to treat malaria. So there have been a few stockouts within Limpopo and Mpumalanga that has a huge impact on treating malaria timeously.
Now, normally, even without the pandemic, children on our continent of Africa are the ones who suffer the most, including in terms of deaths. What are you seeing currently?
Dan, it's sad news. It's the first time, as I said, since 2000 that the deaths have increased. There's more than 420,000 children under the age of 5 in sub-Saharan Africa that passed away from malaria in 2020. This is an increase. The way it's normally described is that a child used to pass away from malaria every 2 minutes. Today, that has become a child in Africa under the age of 5 passing away from malaria every minute. Totally unacceptable right now, but unfortunately, the pandemic has had this negative effect on malaria.
Yeah, and I know your organization does a lot of work in parts of southern Africa. Those numbers, when you bring them closer home here in South Africa, do they mirror that the rest of the continent? A child dying every minute today from malaria?
So in South Africa, we are one of the countries that are close to elimination. We don't have that kind of impact from the disease. In South Africa, we saw 54 deaths from malaria, so a much lower number. Of course, when it's severe malaria, there is access to healthcare in the areas that are affected most in Limpopo and in Mpumalanga. The number of cases also for our infected populations is much lower than what it is, for example, in the likes of Mozambique, Central African Republic, Uganda, and of course Nigeria being the worst hit country on the continent.
Okay, Sherwin, finally, as we conclude, and very briefly, the pandemic in our country, at least now, the numbers are declining. We're seeing other parts of Africa relaxing restrictions as well, and we are waiting here to see for how long more the state of national disaster will last. The president in parliament yesterday saying very soon he will address the nation about that. What would the focus, or what, in your view, should the focus be going forward for the continent in the fight against malaria as things are somehow beginning to settle regarding the coronavirus pandemic? We're still with it, but it's not as bad as it was in 2020.
Dan, the most important thing is to ensure resources that were diverted towards fighting the pandemic come back to the fight against malaria. And I think that's very, very important. We've seen not only financial resource, but human resource being diverted in the fight against COVID. We also need to see that programs get back on track. We are off course in meeting our targets that we set ourselves with the SDGs. 2020 was a report back year, and we've seen we're way behind the target lines. So we need a renewed urgency in malaria to get back on track, and that has to be first prize coming out of COVID.
Thank you very much. Sherwin Charles, founder and CEO of Goodbye Malaria.